Thank you again for introducing me. And good morning, good day, and good evening, colleagues. And it is indeed an honor for me to be part of this forum. And I just want to, maybe before I forget, Prof. Ted, that there is a small correction when you are putting the introduction with my picture on. There was the email, I think it belongs to the other professor. It's not my email though. I think that's just a small error there. Today, I'm just presenting the status of malaria and its implications for elimination in an endemic province of South Africa. Next slide, please. Thank you. This is the outline that I will be presenting, just following the normal article structure. Next slide, please. I just want to say, colleagues, this presentation I'm making has been accepted for publication in the Pan-African Medical Journal. So it is being finalized for the publication. The e-copy is out, but it is being finalized. Next slide. The overview of malaria in South Africa. Malaria transmission in South Africa is seasonal, occurring during the rainy summer period from September to May, and the peak season is January to April. And only 10% of the population is exposed, which is about 5 million people. There are 3 endemic provinces in the whole of South Africa, which is KwaZulu-Natal, Limpopo, and Mpumalanga. And South Africa is now classified as low transmission due to the low incidence. And South Africa is one of the countries which availed itself through to the vision of the WHO of a world free of malaria, and is among the global countries pursuing malaria elimination, as well as one of the 8 countries within the South African development community that is aiming to eliminate malaria by 2030. And therefore, it set a goal of eliminating malaria target by the year 2018. Next slide. Thank you. This map just shows you the regions where malaria is endemic. You can see it's along the borders of next to Zimbabwe and Mozambique, but mainly so next to Mozambique and the Swaziland there. Next slide. The KwaZulu-Natal province historically carried the high burden of malaria in South Africa, which was about 75% of all the cases, and experienced severe outbreaks during the years 1999 to 2000. And cases reached about, I think it was around more than 45,000 in the province alone, which was, as I said, 75% of South Africa. And but through aggressive and intensive malaria control efforts, this burden was reduced during 2020. Maybe go to the next slide for me, please, just to show what it looked like. This is the map that was produced by the South African Malaria Research Unit of the Medical Research Council. You can see during 1999 the cases, and so it was a huge outbreak. But through aggressive malaria control initiatives, the cases were reduced. If you can, please go to the previous slide. Thank you. And then now the province of KwaZulu-Natal is classified as very low transmission. However, it has failed to reach its elimination goal of 2018. And the goal is now, it was revised in 2019 to 2023, but due to the disruptions of COVID, it's been now moved to 2025. Next slide, please. The next one. So the aim of this study was to conduct, to assess the status of malaria in the province, and by quantifying and describing malaria cases for the years 2010 to 2019, as well as highlight some of the reported factors threatening malaria elimination in the province. And this is just a summary of the methods. This study is a descriptive study of malaria cases for those years and using retrospective review. The setting is the province of KwaZulu-Natal, and the data was obtained from the Malaria Information System database, which is owned by the Department of Health in the province. Let's move on. Next slide, thank you. And just a little bit about the province of KwaZulu-Natal. This is the second most populated province in South Africa and carries more than 11 million people, and most of them, about 90%, are rural. And there are only now 3 malaria endemic districts in the province, and the province is located near Eswatini and Mozambique. As you can see in the next map, the location of the province. There is KZN located in South Africa, and in the second map is the KZN, and then there at the top eastern corner is those districts that are located endemic in the province. Thank you. Next slide, please. The sources, as I've already mentioned, were data from the Malaria Information Database, and so what was included is just for the province of KwaZulu-Natal, and for those years 2010 to 2019, patients, records of patients of all ages and sexes, and in total we had 5,787 records, and the data was just analyzed as simple frequencies and percentages. Ethical approval was obtained from the University of KwaZulu-Natal Biomedical Research Ethics Committee, and also permission to access the records or the database was given by the Department of Health in the province. Next slide. Thank you. As I already mentioned, the total number of cases, and just 1.2% of those cases had missing records of the age, and we had about more than 5,684 cases where the age range was from 0 to 90 years, and the majority of them were adults in their age 16 to 35, and also more than 36 years to up to 90, but very few in the pediatric population. And let's move to the next slide, which is the table. Yes, thank you. And we see that most of them were males, which is 65.9%. And also we asked the ones that had a travel history. We found that most of them, 56% of those, are local people that contracted malaria with South Africa, and about 43%, more than 43% contracted malaria outside the province and South Africa, which means they were imported. And the majority of those cases were due to Plasmodium falciparum. Next slide. Then the annual malaria cases, we see that the cases were highest during the year 2018, and some cases, outbreaks in 2017 and 14. Let's go to the figure, following slide. Thank you. As you can see, this is the annual cases, but which is broken down by the sex. And you see, when you look at it, if you look at the blue one, you see that the majority were males. But at the same time, what you're seeing is that all the cases were highest in 2018, which is the year that was set to target malaria or to eliminate malaria. But during that year, the cases just increased. Next slide. Okay, thank you. This one is it's the results by the age. What you see here, the green line, the big one, it shows that the burden of cases was highest in the age group 16 to 35 years. And we see that in the under fives, the cases were very low, which is really in contrast of the picture that we normally see in high transmission areas, where the under fives are the ones that suffer the most burden of malaria, but not in this case, in this study. And in this one, it was the young ones, the youth, that are the adults that were suffering a lot from malaria. Okay, thank you. That's fine. Thank you. I think what the results are showing us, I just want to emphasize first the point that the results are important because WHO recommends that we must collect frequent data to support elimination activities. And also the results confirm an upsurge in malaria and occasional outbreaks in the province of KwaZulu-Natal and South Africa. And we see that in this study, all the ages in the population are at risk of malaria due to the lack of immunity. Also, we see the high number of cases in the adult or years. As I explained, that it is not the norm that in sub-Saharan Africa or in high transmission areas, you see adult populations being affected. Normally, we see the children and the babies being the ones that are suffering mostly from malaria. And we also see a high number of cases in the males, which also is not the picture that we normally see in sub-Saharan Africa, because normally we see the women, especially pregnant women, being affected by malaria. And this study also confirmed that the Plasmodium falciparum remains the most common parasite transmitting malaria in sub-Saharan Africa. And I just want to say that also the local transmission of cases, it reveals a pattern of travel during malaria to malaria endemic districts in South Africa, maybe during the transmission season, which happens normally during the summer holiday period. Next slide, please. Therefore, when it comes to the implications of malaria elimination, there are many challenges that are given in the literature. And here I just want to maybe present about 5 of those. And the first one is imported malaria. As you've seen in the results, that more than 43% of the people were affected by imported malaria, meaning they came with malaria from other regions. And also related to that is the asymptomatic infections, which this study did not look at, but it is one of the challenges that South Africa is having. One of my colleagues from the South African Medical Research Council recently did a study at the corner of the province of KwaZulu-Natal and found that all the infections were asymptomatic and they were also imported, but all of them came from Mozambique. And also there were sporadic reports, few reports of asymptomatic infections in areas where malaria is not endemic. Again, climatic factors. One of our students collected data and analyzed the climatic factors, especially rainfall and temperature, and found that they were linked to high increase of malaria in the province. Then there is migration and movement of people. This is also one of the problems with South Africa having free access to the country, people coming in to trade daily or to use health services. So there is a great movement. And in 2018 alone, it's reported that more than 800,000 people crossed the border of KwaZulu-Natal coming into the province. So we have a problem of movement of people coming into the province. And also another factor that was highlighted by some of my colleagues in South Africa is the health system factors. This one is reported that because of the targeted approach to control malaria in certain areas, hotspots, so the coverage was very low for the province, and only to find that that wasn't adequate to really reduce the burden of malaria during that year. And therefore, they are aiming now that 95% of the coverage, they should at least reach 95% of coverage with the insecticide sprays and also other means of malaria control to support the elimination project. Next slide. I just want to highlight just the three study limitations. One of them is because the data was not meant for research, therefore the variables that were collected are the ones that were there at the time. So I could not get the variables that I needed, but this at least were able to give me a better understanding of the burden of malaria in the province. And also there was an issue of incomplete data, as I've shown you that some of the variables like the age, 1.2% of them had missing data. Again, because this was, the data is collected for surveillance and also for reporting, for notifying the Department of Health, they usually don't use any sampling, which is used in research. They just collect the data as it comes. So that could be another limitation. But for me, I use all the data that was available to overcome that limitation. Thank you. Let's move to the next slide. Just to conclude, the study shows that there is an increase indeed of the P. falciparum malaria in the province among the males, which are young adults as well, and particularly during the year that was earmarked for elimination. And we see that both the increase in malaria and the imported cases, together with other factors, they pose a challenge for elimination in South Africa. And I just want to go to the recommendations. Next slide. Thank you. To attain the malaria elimination goal now set for 2023, but now moved to 2025, I would like to recommend that future strategies include strengthening the health system, malaria elimination efforts, and secondly, that implementation of cross-border malaria interventions become compulsory. There are talk that these have been implemented, but they are not actually enforced. So I recommend that they be made compulsory to pick up both imported and asymptomatic infections. I think with the emergence of COVID-19, this shouldn't be a problem now with compliance for people to comply with the requirements of compulsory screening. Thirdly, I just want to recommend that further research on factors associated with the increase of malaria cases and other malaria preventive measures during the malaria transmission season. This should be it should be conducted. And lastly, I want to recommend that to prevent imported malaria cases and the feasibility of introducing cross-border malaria interventions, this should be researched and find out which is the best way to prevent these imported cases. Next slide. And the next slide. And the next one. Thank you. The last one, please. Thank you, colleagues, for listening. And I'm happy to take any questions in case there is some time left for me. I just want to say that my interest is public health, health systems and policy, and epidemiology, and also control and prevention of communicable diseases, malaria and NTDs. And also I'm interested in health research ethics. Thank you.